Hello, everyone. Welcome to Healthy and Uplifted monthly webinar. Our topic for today is maternal birthing health with an emphasis on Black maternal birthing health. This is our last webinar for the year, so we're excited to end this year with an important topic. Before we get started, let's take a minute, please, to honor our sister, Dr. Shanice Wallace, that recently passed away during pregnancy. So let's just take 30 seconds to just reflect and think of her. She was a physician. She was a chief resident in Indiana that passed away. So let's take a minute to just honor her. Thank you guys for honoring her. She died from preeclampsia. She had a ruptured liver. The baby survived via C-section, but unfortunately, she didn't make it. Again, this leads us to our conversation. Even if you belong to a higher socioeconomic status, are you still affected by your race in pregnancy? So we're going to be having that discussion. This webinar is on Black maternal birthing health, okay? I'm going to be co-moderating this with Dr. Malcolm. Dr. Malcolm is known to friends and family as Terry. She is a certified physician executive. She's also a board certified obstetrician gynecologist. She's a certified physician coach and the founder of Masters Physician Leaders. Our next keynote speaker, one of them is Dr. Adams. Thank you, Dr. Adams, for being here. She's an assistant professor at Baylor College of Medicine in the Department of Molecular and Human Genetics and Maternal Fetal Medicine. She has developed a special interest in developing ways to reduce health disparities surrounding reproductive health. Ms. Pinkney is a millennial certified midwife, as well as a birth and personal growth coach. She's passionate about birth, women's empowerment, and healthcare education. Our master keynote speaker is Miss Tibbs. We call her Ngozi. Ngozi is a nationally recognized speaker and educator on anti-racism, cultural humility, and maternal childbirth. She serves as a lactation consultant and childbirth educator in a private practice. She currently works at the largest hospital in Western Pennsylvania and with Healthy Start Pittsburgh. So we're going to switch gears and have our master keynote speaker begin her presentation. But before she begins, I hope you guys will join me in welcoming all of our speakers.
Thank you. Thank you so much. In the United States, our maternal death rate is way too high. Losing one mother is too many. But if you look at Black women, white women, and Hispanic women, we are almost dying at triple the rate of our white and Hispanic counterparts. And as I mentioned in the introduction, many of these deaths are preventable. And we have to do better, not just talk about it. We need to discuss how systemic racism is the problem. Black women's bodies are not broken. The system that we live in, however, is. Even Black women who are educated, even Black women that are physicians, even Black women who are millionaires and have access to the best health care our nation can provide are not protected. Some of you know the story of our dear sister, Serena. She had her baby by cesarean, and she recognized that there was something happening with her breathing. She spoke to her nursing staff and said, "I don't feel well." Her nursing staff told her, "You're okay, you just had a baby. Some of these things are normal." She said, "No, I have a history of blood clots. There is something not right about my breathing and I don't feel well." Her providers ignored her pleas until she insisted that someone listen to her. An ultrasound was done and they found a blood clot in her lung. Our sister could have left us had she not insisted that someone listen to her and order tests that saved her life. I think about our sister that we had a moment of silence for, who had preeclampsia. I also have preeclampsia with my fifth child. We were concerned that maybe it was just adrenaline because our fifth baby was born in the car on the way to the midwife center. But there was one liver enzyme that our blood count, our blood results showed us, as my doctor said, was one liver enzyme that was a little upset with us. And as a result, I took magnesium sulfate for 24 hours. They were able to relax those blood vessels so my blood pressure could come down. But I also could have been a statistic. So here's what we know. Even Black women who are millionaires, even Black women who are physicians, even Black women who have PhDs are unfortunately not protected. And we have to do better. How do we do that? We need more Black midwives.
This is Healthy and Uplifted monthly webinar. Our topic of discussion is maternal birthing health with an emphasis on Black maternal birthing health. This is a transparent conversation. We have amazing keynote speakers. If you missed the introduction, check out our website and you'll get more information. I'm going to hand over the first question to Dr. Malcolm. Dr. Malcolm.
Ngozi, again, thank you for such an enriching discussion and really enlightening about where we are today and thinking about where we are today and the kind of care and the level of care and the quality of care that we are providing to our Black women and how it relates to having a high quality outcome for their birth. I'd love to hear from you. What do you think it means to be an expectant mother today? What does it mean to be a Black woman who is expecting a child today?
And I think that right now, many Black women are filled with anxiety as they're thinking about bringing their babies into the world, and we have to surround them. We have to surround them with love and care and compassion, and providers of all races that, first of all, acknowledge that sisters are nervous right now, and they have every right to be. But what I'm encouraging my clients to do is have the conversations with your provider. Let them know how you are feeling, that you are nervous, and I encourage them to ask their providers, what are they willing to do? And what are they able to do to reduce their risk of a poor birth outcome? That they have that right to have that conversation with their providers. That is so very important. So I actually teach a class about how to have a conversation with your doc. Mm-hmm. Many families are intimidated by that. They're concerned that if someone gets the impression that they're being the difficult patient, that they won't receive respectful and compassionate care. That is problematic, and we need to do better. We need our providers to let their patients know that their goal is a healthy birth outcome, healthy mother and healthy baby. And in order to do that, conversations need to be had at the beginning of pregnancy. Talk with families about how they're eating. Talk with families about reducing their stress level. That is so very important. So our sisters are nervous, but we also want our sisters to be hopeful, because there are providers out there that are here to make a positive difference in their lives.
Thank you so much, Sister Ngozi. You made a very good point. On an unfortunate one that most Black mothers are nervous. I believe Doreen in the chat also echoed your sentiment. This question is for Dr. Adams. Dr. Adams is a high-risk obstetrician and a geneticist as well. Dr. Adams, should Black moms be nervous about hospital delivery? Are their deaths preventable?
I think that, it's very reasonable to be nervous because we all see what the statistics are. And I think it's important to be vigilant and pay attention to those things. But I think one of the big points that was brought up during the keynote talk was that we always have to remember is that Black bodies are not broken, right? I think that was a really great point to emphasize. And so I think that when you see all of the headlines and all of this information, you're bringing this stress that, that you don't have to necessarily bring with you into a pregnancy. I think so we want to always remember that we are strong, we are healthy, we are capable of doing these things. And there are ways that you can arm yourself to have a healthy pregnancy. And I think that those big things are, one, educating yourself about what your personal risks are and asking your doctor about what those risks are and how to mitigate those risks. Optimizing your health, making sure you have the right support going into a pregnancy so that you're not going into it alone. Maybe having your family members, your spouse, things like that with you to ask questions with you so you can see things from different perspectives.
Dr. Adams, great points, and really reminding all of us to educate ourselves, to be informed, and so along those lines, Ms. Pickney, I'm going to turn this question to you. Is where do you suggest that we find that information? How do we educate ourselves with evidence-based information, with scientific data? How do we know what's really truthful and what's accurate so that we can be equipped with the right information to engage in these conversations with our healthcare providers?
As a midwife, I always advocate for preparing for your birth. So finding and starting your birth village, as I always say to my patients, you need a birth village. You need people that are going to be in your circle that are going to be able to help you and educate you. So one thing that I would say is taking a childbirth education class. In those classes, I know a lot of people that are like, I don't think I need that. I'm just going to have my baby. And I'm like, it's so important to do that, because in a childbirth education, that's where you can ask those questions. I'm actually a childbirth educator myself, because I wanted to bring a different approach to educating, adding the what we kind of been talking about, advocating for yourself. If you know more about your options, you know all your options, then you will be able to advocate for yourself and know if someone says, oh, well, you need to do this, or you can't have a C-section, or you can't do this. And then you can be able to come in there and say, well, I learned this in my class, or just being around people that can give you that evidence-based, information so that you can know your options and know what kind of questions to ask.
Thank you so much, Ms. Pickney. I'm going to ask this question to all of you. The question is, I've practiced as an obstetrician post-residency for 5 years, and I think there's a trend in the health of our patients. I do know we're focused on preventable deaths that were preventable. But can you guys touch maybe Dr. Adams, even Dr. Malcolm as a moderator, can you touch on the change in maternal demographics that are having births? And is that the consequences of older women having births, more obese women having health?
Definitely, when we look at maternal mortality, Black women in general have a much increased risk for maternal mortality and for severe maternal morbidity during pregnancy. If you were to parse that data out a little bit more and look at age groups, women who are over 35, women who are over 40 are going to have higher risks than women who are younger, especially when we look at things like hypertensive disease, cardiovascular disease. Those kinds of complications are going to be more common in older women. And so, yes, we do see women who are having pregnancies a little bit later. We do need to think about what we can do to optimize any pre-existing medical conditions before pregnancy.
Yeah, and I guess I would just second really what Dr. Adams said as far as anecdotal evidence surrounding the increase in age demographics. I'm don't have solid data to share with all of you, but I will just share from my clinical practice. What I definitely saw were more and more women delaying childbirth because they had professional goals that they wanted to achieve. They had educational goals that they wanted to achieve. And if that's the path that you are on, you may choose to stay very focused on your schooling, to really go after, particular degrees, or maybe securing a certain job. You also, we know having children today is expensive. Children cost, and our bodies change, and we kind of take for granted that our healthy state 20 is going to exist until our mid to late 30s, even our early 40s. And it's so important in optimizing any conditions that you have prior to becoming pregnant, and really, talking to your obstetrician or your primary care doctor about, I'm thinking of delaying pregnancy, or I'm thinking about now getting pregnant and I'm 40 or I'm 41, and how aggressive do I need to be about trying to get pregnant? What things do I need to make sure that are like in tip-top shape before I start getting pregnant? And can you help me in doing that? Because along with a delay in the pregnancy, there could be an increased surveillance that's necessary to help you have that optimal pregnancy.
I agree a lot with what Dr. Adams and Dr. Malcolm both said. So it's just basically that preconception piece, especially when I do annual exams with my patients, it's kind of making sure I'm diving in. So when are you thinking about getting pregnant? Like having the conversation early. So as they mentioned, then we can, like, if we need to change your blood pressure medication, if we need to talk about what diet we can do or what some things we can start changing. And I think the mental health piece is so important, because and that goes with having a provider that you feel comfortable. I've had a lot of people come to me and say a lot of different things just because I asked. They're like, oh, well, nobody really asked me about that. So it's really important to make sure that as providers, we're asking the questions about mental health, and then also being, vigilant with our patients about the importance of just taking care of yourself and your body, in regards to also wanting to have a baby as well.
Great point. So we have people asking questions. So I'm going to open it quickly to some of our attendees. The first question is by Janice. Janice, are you there?
Two things kind of come to my mind, and I want to bring up allostatic load. As we all know, as Black women, we carry a tremendous burden. And how we manage that stress, I believe, often plays, and studies are showing now, plays into our health outcomes. So when a woman comes into your practice, and let's say she did not have the foresight to talk to any of you before making the decision to get pregnant, but she is pregnant. Mm-hmm. How do you counsel her? How do you work with her and help her to understand disease sequela that is associated with the allostatic load, that pressure that she must bear often as a single parent?
So one of the things that I do as a provider with talking about stress and how that can play a big part in your pregnancy. So I, just talk to my patients. One of the things that, we all know that is not always done is I just listen. I talk to my patients, they come in, I'm like, okay, you're pregnant, what's worrying you? Because sometimes it's just releasing, like sometimes we're overwhelmed, just talking it out, just saying what we need, what we're afraid of, our fears. That is one thing that I try to do with my patients. Tell me, what are you feeling? Are you needing help with food? Are you feeling like I can't do this pregnancy? Let me know how I can help you. Because that's one thing of me, like not telling, well, you need to do this as a mother. You need to make sure you get this. Like, that's not the approach that's going to work. It's me being able to, advocate and listen and get my patients the, resources that they need.
Thank you so much. So before we wrap up things, there are things we need to do. Before that, I want each of you to give me 30 seconds each, or a 30-second statement about tips or just something to leave with the audience as we wrap up.
One is most certainly to self-advocate. I think that that's been said over and over again, that you know yourself better than anybody else. So do not be afraid to self-advocate.
Find people in your community, find who the cultural brokers are, who are the respective elders in your community. See if you can link up with these folks. And we need those town halls. We need to have those discussions so that as a community, we can share with the institutions and providers what we need. And that way we can walk hand in hand together and have that healthy Black family.
Even with all the fear, I always want to encourage and empower you as women to know that, you have power over your body. And that's why my brand is called She Births From Within, because you have everything you already need inside of you. You're already worthy. It's just getting those resources, getting that birth village, and just empowering you and knowing that you're going to be a great mom, you're a great parent, and just knowing that within yourself as well.
Black women are not broken. I feel like that has to be the theme for life. But also just from the, perspective of, especially during this pandemic, this time where we're kind of all stressed and pushing things aside, preventative care is still important. Please still see your doctors, check in on your health, do all the things you need to do, put your health as a top priority.
All right, so our next program will be in January. We're taking a break in December to rest and recuperate. January, we're talking about outstanding and standing out, how to become a boss woman. We're going to be having leaders in medicine come teach us how to climb that ladder. We see our Vice President-elect Kamala Harris, she made it. So all of us can make it too. She has shattered that ceiling. We hope that more of us will do the same. And so we'll be having that conversation. Please save the date, January 10th, 4 p.m. to 5:30 p.m.